Emergency childbirth may occur in situations where medical assistance is unavailable, such as during natural disasters, war, or other crisis scenarios. This guide provides essential steps to ensure the safe delivery of a baby under emergency conditions. It is based on the handbook jointly developed by the U. Department of Defense Office of Civil Defense and the Public Health Service. General guidelines for emergency childbirth. What to do. Stay calm and reassure the mother. Panic can create additional stress, which may complicate the birth process. Encourage the mother and provide emotional support. Choose a safe and clean area. Find a secure, well-lit, and warm location for the mother to lie down. Hygiene is crucial. Wash your hands thoroughly with soap and water. Use clean towels or cloths. Observe signs of labor. Key signs include persistent back pain and cramping, bloody tinged mucus discharge, rupture of the amniotic sac, water breaking. Monitor contractions if contractions occur frequently and last for extended periods. Birth is imminent. Support the birth process. Allow the baby to be born naturally, without pulling or forcing. Ensure the baby can breathe. After birth, check for breathing and clear the airway if necessary. Keep the baby warm. Place the newborn on the mother's chest for warmth and bonding. Wait for the placenta to be delivered. Do not pull on the umbilical cord. Let the placenta come out naturally. Encourage breastfeeding. This helps the mother's uterus contract and reduces bleeding. What not to do. Do not hurry. Childbirth takes time, and forcing it can cause complications. Do not pull the baby out. Let nature take its course. Do not cut the cord immediately. Wait until both the baby and placenta are delivered. Do not give the mother any medication, unless prescribed by a medical professional. Do not touch the birth canal unnecessarily. Maintain strict hygiene to prevent infection. Special precautions for pregnant women in emergency situations. Avoid radiation exposure. Pregnant women should be in the most protected area of a shelter. Minimize physical exertion. Avoid lifting heavy objects or standing for long periods. Prioritize nutrition in case of food shortages. Pregnant women should receive priority for available food and water. Prepare an emergency childbirth kit. See section below. Stages of labor. First stage, early and active labor. The cervix begins to dilate. Contractions become stronger and more frequent over time. The mother may feel discomfort in the lower back and abdomen. As labor progresses, contractions become more intense. Second stage, birth of the baby. The cervix is fully open, and the baby moves down the birth canal. The mother feels an intense urge to push. The baby's head usually emerges first. Normal delivery position. The newborn should be gently guided out without pulling. If the umbilical cord is wrapped around the baby's neck, try to loosen it gently. Once delivered, clear the airway and ensure the baby is breathing. Third stage, delivery of the placenta. The placenta detaches naturally within a short period. Do not pull on the umbilical cord. If excessive bleeding occurs, gently massage the mother's abdomen. Keeping the baby close and encouraging breastfeeding helps the uterus contract. Cutting the umbilical cord. Wait before cutting. Tie the cord in 2 places. One position a short distance from the baby. Another position farther down. Use a sterilized tool, scissors, knife, or razor blade to cut between the 2 ties. Cover the baby's navel with a sterile dressing. Emergency measures. If the baby is not breathing, perform gentle mouth-to-mouth resuscitation with small puffs of air. If the mother is bleeding heavily, apply firm pressure on the abdomen and keep her warm. If a miscarriage occurs, keep the mother in bed. Elevate her legs and provide fluids. Expectant mother's emergency childbirth kit. A lightweight emergency childbirth kit should contain a clean cloth or receiving blanket, diapers and sanitary pads, soap and hand sanitizer, sterilized scissors or razor blade, cotton tape for tying the umbilical cord, identification tapes for mother and baby. See next section. Identification of mother and baby. In emergency conditions, proper identification is crucial. For the mother, name, blood type, Rh factor, home address and emergency contact, number of previous births. For the baby, date and time of birth, parents' names and address. Conclusion. Emergency childbirth requires calm, patience, and basic knowledge of the birthing process. By following these steps, individuals can help ensure the safety and well-being of both the mother and baby in crisis situations. Preparation, hygiene, and minimal intervention are key to a successful emergency birth.